I'm Chaka Suzuki with Real Self TV, and I am here with Dr. Todd Becker, and we are going to be talking about Vbeam. Could you tell us where you practice and your specialty, please?
I practice in Boulder, Colorado. I'm a dermatologist and Mohs surgeon.
And Vbeam, it sounds like something from the future. What does it treat, and what is it?
Well, V is used for vascular, and that's basically what it focuses on, vascular problems. So whether it's a vein or a vascular malformation or just redness, the Vbeam is really a go-to device.
And is it mostly used on the face, or can it also be used on other parts of the body like varicose veins?
It can be used anywhere on the body. We use it primarily on the face. That's where most people notice those subtle veins and diffuse redness even.
So is rosacea something that the Vbeam can treat effectively?
Rosacea is a fantastic target for the Vbeam because you don't have to have a specific vein that you see. You can treat just general redness in the face.
And how do you know with the redness in your face that it's time to come see you to get treated by Vbeam? What are the signs?
Well, if we have redness that doesn't improve, everyone flushes now and then, but you have persistent redness that's becoming a problem, that's when we can really help. And the Vbeam is great because there's really no downtime with it. People ask after a treatment, oh gosh, what am I going to need to do? Really nothing. The cooling spray comes with it, and it's a really, really effective and relatively painless treatment.
And what does the skin look like after treatment? Will there be extra redness? Will there be any swollen? What should people expect when it comes to treatment?
Well, what we see is that since we have a cooling spray that protects the skin, there's no damage to the surface. Someone will be a little extra red, but usually people are used to that by then. But no damage and really no downtime, just a little more red.
That's great. And if someone is looking to get this treatment before an event, how far in advance do you think they should be thinking about it?
I wouldn't want to have a treatment within a week or so of an important event. Not that you're going to have downtime, but you just want to be sure you're completely healed.
Great. So maybe a couple weeks before a big event like a wedding.
Absolutely, that'd be perfect.
Okay, great. Well, thank you so much for spending time with us. And if you would like to know more, then you can go and visit Dr. Becker on his realself.com profile. Thank you so much. We are down in San Diego with America's top dermatologists, including Dr. Jeremy Brower. Welcome.
Thanks for having me.
Today we are going to talk about Vbeam, but before that we do that, can you tell us what your specialty is and where you practice?
Sure. So I practice in Manhattan, in New York, at the Laser and Skin Surgery Center of New York, and I am a Mohs surgeon, but also do laser surgery and cosmetic surgery.
All right, let's talk about Vbeam. What is it, and what does the device look like? What can I expect when I come into your office to get treated?
Vbeam is a highly utilized laser in our practice. It is a pulsed dye laser, meaning that it specifically targets what we call vascular lesions or conditions, so anything that's related to blood vessels.
Oh. And how do these blood vessel problems come about? Sun damage?
So it could be sun damage, scarring. There are medical conditions that there's overgrowth or overproliferation of blood vessels, such as a port wine stain, hemangiomas. You can have broken blood vessels, also known as telangiectasias, that appear in highly vascularized areas like the middle of the face. So a lot of people will have broken blood vessels on their cheeks, their nose, on their chin. Conditions such as rosacea, where there's a background of redness or erythema that's going to be involved as well.
And you mentioned port wine stains, which I think usually gets treated early on in life. Is there a certain age where you should be over to be treated by Vbeam, or is it any age?
We firmly believe the earlier the better. So early intervention is right after birth. If it's evident, we'll treat it.
Oh wow, and it's safe to use lasers right after birth?
It is, yes.
And are there any risks associated with the Vbeam that our viewers should be aware of when considering this treatment?
So there are always risks with lasers. You have to make sure that you select the appropriate physician to perform the treatment, who hopefully will know if you're an appropriate candidate, if your condition is appropriate, what the parameters or settings that should be used, how often treatment should be performed. So as long as you are confident in your practitioner and they're confident in their ability, you should be good. But there is always a risk of scarring, change in pigmentation with lasers.
And what does it feel like when you're using the Vbeam? Is it painful? Do you use topical anesthetic?
So we do use topical anesthetic many times. If not, what you can expect to feel is a rubber band snap. And prior to that, it's a cold spray. prior to the rubber band snap sensation.
And after the treatment, is there anything about aftercare that our viewers should know about? Any creams or icing or?
So depending on what condition we're treating and how aggressive we are treating you, you can be left with pretty significant bruising. So to minimize, or I should say to expedite the clearance of that, we actually have started to use the Vbeam 2 days after initial treatment. In some cases, some are using it even sooner to expedite the clearance of that bruising. Otherwise, good sun protection. You can use ice to minimize some of the swelling.
Okay, great. Well, thank you. That was so much great information, Dr. Brower. And if you'd like to learn more about him, you can check him out on his profile on realself.com. Thanks so much. We'll see you again soon. I am here with America's top dermatologists, including Dr. Omar Ibrahimi. Could you tell us where you practice and what your specialty is?
Sure. I'm a dermatologic surgeon, and I practice in Stamford, Connecticut.
Awesome. Let's talk about redness and ways to treat it. It's something that a lot of women suffer from, and what can be done about it?
Sure. Facial redness is extremely common, especially in the Northeast where I practice. There's a variety of ways to treat it, topical medications, avoiding the triggers. But what I find in my practice is the laser, the Vbeam Perfecta laser, is actually a workhorse for treating facial redness.
And how does that work, treating redness? And is it painful, which is a big question from our community, the Real Self community?
Great. So the laser, it's 595 nanometers, and what it does is it targets hemoglobin, which is in red blood cells, and it in a very precise way will heat up and damage the blood vessels. So it involves a little minimal discomfort, but again, nothing's a magic wand, so a little bit of discomfort to take care of a problem is usually well tolerated by most patients.
And how many sessions do you typically see someone needing for redness?
Right. It really depends on what we're treating. So if they have a couple of those red spots, which I call cherry angiomas, those can go away with a single treatment. If they have more rosacea, that's a condition that it's genetic, and there's some things that trigger it. So it generally takes a series of treatments to treat that.
And there are a number of lasers out there that treat redness. So what makes Vbeam different?
I find it to be a workhorse laser. So the wavelength, the 595 wavelength, tends to penetrate a little deeper into the skin compared to some of the other vascular lasers. Also, the handpiece on this device comes with a little cooling apparatus as well. So it's able to cool and protect the epidermis so that you can use more energy to achieve the improvement in the redness without harming the epidermis.
Now, is there any topical anesthesia that's used with this, or do you need it?
I tend to actually not use any topical anesthesia. Sometimes for the more advanced birthmarks, we will use a little bit of topical anesthesia, but most people tolerate it with extremely minimal downtime and discomfort.
Well, that's great. Okay, and what about the risks with the Vbeam? Are there risks of burns, or what do people need to be aware of?
The Vbeam is actually probably the safest laser that I have in my practice. Afterwards, most people are a little red and swollen, but generally it's very safe. You have to wear some goggles to protect your eyes. There's a very minimal risk of lasting redness, but it's so negligible compared to other lasers. It's actually very safe and well tolerated.
And after someone gets the Vbeam treatment done, is there anything with aftercare that they should be aware of?
Yeah, it's so the Vbeam's a non-ablative laser, so it doesn't actually break the skin. So I tend to tell my patients just to continue their regular skincare regimen.
Oh, great! So when they get a treatment done, is it sort of in and out, and I can get back to my usual day, or?
Yeah, absolutely. If we're treating a common condition like rosacea, they're usually out. They're a little bit red and swollen, which might last a day or two, but generally they can resume their activities, go back to work. I tell them to tell their coworkers that they had a treatment for sun damage, and they have a little redness and swelling, and nobody knows.
Oh, that's awesome. All right, well, I feel like we got a lot of helpful information about the Vbeam. Thank you so much for taking the time to speak with us. And if you'd like to know more about Dr. Ibrahimi, you can check him out on his profile on realself.com. We are down in sunny Southern California with America's top dermatologists, including Dr. Matt Mulberg. Hello.
Hi, how are you today?
Good, how are you?
Good, thank you.
Could you share with us your specialty and where you practice?
Sure, I'm a dermatologist and dermatologic surgeon in Northern Colorado.
We are going to go over Vbeam 101 with you. Can you tell me what is it?
Sure, a Vbeam is a pulse-dye laser. A pulse-dye laser is a laser that's designed to treat blood vessels. So blood vessels often will occur on the face, the legs sometimes, the neck, hands, And this is a very targeted blood vessel laser that helps to eliminate those blood vessels, but leaves the rest of the skin unharmed.
And what happens when you go in to get Vbeam? What is it like? What does the machine look like? A lot of real selfers, they like to know before they go into the doctor's office what to expect.
Absolutely. So the laser is a device that's in the office. It's a no anesthesia procedure. So you walk in, it takes about 5 to 10 minutes to treat, and you walk right out. Depending on the settings that we choose for the laser, there can be a little bit of downtime, meaning some bruising or redness, or no downtime, minus a little bit of redness and a little bit of swelling. So it's a quick treatment that usually people can do at the end of the day, and by the next morning look very normal, or even walk out if they don't mind a little bit of swelling and still look like themselves.
And do you see results that quick, as fast as the next day?
So it depends on the treatment that you're utilizing and what you're using it for, but the most common thing that we use it for is something called rosacea. And rosacea is a rash, sometimes that occurs on the face, but it also comes in a form where people will develop excessive blood vessels. And certain people of different ancestries will develop that. Irish people or Scottish people will more generally develop that on the face. So they get redness and blood vessels across the face. In that circumstance, we can see improvement with one treatment, but sometimes it can take 3 to 5 treatments to really get it all cleared up.
And when we think about lasers in the face, I think a lot of people get scared about what it's going to, if it's going to hurt. So can you talk a little bit about that? I know the treatment's pretty short, so that's good, but pain management and expectation.
Sure. So the treatment is a no anesthesia procedure. So we generally have patients come in, there's no injections, there's no topical anesthesia necessarily needed. And what's done is there's a little puff of a laser. It feels like a quick puff of air. Some people will equate it to a slightly not so painful snap of a rubber band, but it's not very painful. I mean, it's just like a bunch of little puffs of quick air on your face, and you're fine. So most patients, we do a warning sort of test shot, and we just zap them with one laser. They get used to it, and then we just proceed from there. So it's a very comfortable and very manageable treatment.
And is there anything for aftercare after the treatment they need to know? Ice or special serums, lotions, oils, anything for after the procedure?
The main thing we want to do is make sure people are being very good with sun protection. And I'm a dermatologist, so I say that to everyone.
Yes,
but particularly important after laser, because sometimes people, if they're treated too aggressively or with aggressive settings and they go out and have a lot of sun, they can get some darkening of the skin. So we're very careful with sun exposure after the treatment. And then if they have a bit of bruising, which can sometimes happen with our more aggressive settings, they can cover that up with some makeup immediately afterwards. So ice is usually helpful just to minimize swelling, particularly if we're treating blood vessels around the eyes. But it's really well tolerated, and there's really not much aftercare at all. So there is one other indication we'll sometimes use it for, which is called hemangiomas or port wine stains. And these are the birthmarks that people will have.
Yes.
That are big red patches or even blood vessel growths that children can have. Those we typically have to use higher settings and stronger settings, and sometimes they'll have some bruising afterwards. So in those circumstances, we'll have a little bit more downtime.
And it does seem like for port wine stains, children get treated. Is Vbeam safe for all ages?
It is. It's most effective in children to treat port wine stains, but even adults, it can be very effective. Sometimes it requires more treatments to do that, though.
Hey, great. Thank you so much, Dr. Malberg. So much great information. If you'd like to learn more about him, check him out on his profile on realself.com. Thanks again.
Thank you so much.
And we are down in San Diego with America's top dermatologists, including Dr. Jerome Potaskin. Welcome.
Thank you very much. It's great to be here.
And what is your specialty and where do you practice, Dr. Potaskin?
My specialty is dermatologic surgery, and I practice in the lovely community of Danville, California.
Oh, I've been to Danville.
It's a great place and great people.
We are here to talk today about Vbeam. What do our viewers need to know about Vbeam? What does it treat?
So the Vbeam is a pulse dye laser that treats anything red on the skin. So the things we use it most commonly for are rosacea, broken capillaries on the face. It was actually originally invented for babies with port wine stains, so it's even safe to use in kids.
Great. And does it hurt? That's probably going to be the biggest question from our Real Self community is they always want to know, what does it feel like? Okay, so does it hurt is a great question. I am the biggest chicken, and I've actually had these treatments myself, and they sting a little bit, but they're very tolerable. And how much does it cost? That's another question we get from our community a lot as they're shopping around. What's a typical cost for a treatment like this? And is it one session or is it usually multiple sessions? It's usually multiple sessions, and the cost really depends upon how large an area we're treating. So I would say you can expect it to start at about $250 and up from there, depending upon the size of the area. And how does this compare to other similar treatments out on the market?
So the pulse dye laser has been around the longest. It was the first laser that was designed specifically for a skin purpose, but it's been improved year after year after year. It's one of the safest treatments out there, and it's one of the most effective treatments today for anything that's red on the face. Rosacea, broken capillaries, birthmarks.
What is aftercare like for this laser treatment? Is it, will I have to take a lot of time off of work, or what are the expectations?
So in the old days when the Vbeam first came out, people were black or purple for 2 weeks, and you really couldn't go out socially. But the device has changed over time, so most people that we treat are back to work the next day. They might have a little bit of bruising, a little bit of swelling, but for the most part, if people come in on a Friday for a treatment, they're back at work on a Monday, or if they come in on any other day, they're back at work the next day.
And is there anything with the aftercare that you need to do to ensure that you keep those great results?
Sun protection, sunscreen, etc.
Okay, great. Well, thank you so much for sharing so much information on Vbeam, Dr. Potoskin. It has been fantastic talking to you. If you'd like to learn more about him, you can check him out on his Real Self profile. Thank you so much. We'll see you next time. I am here with America's top dermatologists, including Dr. Kathleen Welsh. Could you tell us where you practice and what your specialty is, please?
I practice in San Francisco, California, and I practice primarily cosmetic dermatology.
Let's talk about Vbeam. What do consumers need to know about Vbeam? What does it treat?
Facial redness is a problem for many, many people. It can occur from a skin condition called rosacea, a family genetic condition, or from sun damage. And the Vbeam laser safely treats facial redness. And this improves the quality and texture of skin as well as the tone of skin.
And what makes you a good candidate for Vbeam? When do you know that the next step is to go under the laser?
When you feel that you can't go outside without makeup any longer, or if people ask you if you've been in the sun, or are you embarrassed, then you know that you have persistent facial redness and you could greatly benefit from a laser treatment.
And is Vbeam something that can treat these kind of beauty problems with one treatment or multiple treatments? What's the average number of treatments that you need to do to be effective?
Well, it really depends on how much redness you have. A mild condition would get great improvement from 1 or 2 treatments, but if you have severe redness and lots of broken veins, you might take 3 to 4 treatments to see the results you want. Our goal is to get patients outside with just a light tinted sunscreen or no makeup at all.
And what does it feel like when you're getting Vbeam? Is it a painful treatment? Could you explain to the consumers what it feels like?
Well, it's not entirely comfortable. It feels like a very light rubber band being snapped on your skin. We do try to make you more comfortable by using ice and by giving you squeezy balls. It's a little uncomfortable. I've never had a patient decide not to do it because it hurt too much.
And is there any topical anesthesia or anything else that you use with a treatment like this?
Topical anesthesia would make the treatment less effective, but again, we do use ice.
Okay, great. And how long do the results last?
Well, if you were a 35-year-old person and you had facial redness and you got back to your normal skin color, it would probably take 35 more years to get as bad as you were before. However, if you were suffering from rosacea, you might have to do maintenance treatments every 2 to 3 years.
Okay, that's interesting. And is there anything that if I'm considering Vbeam, anything that I need to do pre-treatment to get prepared?
Well, you should not have a tan, and you also should not be on any blood thinners such as aspirin or vitamin E or fish oil.
And what are the risks associated with Vbeam?
It's an extremely safe treatment. However, there are risks of excessive swelling, and so you should let your doctor know if you have social events coming up immediately after the treatment. Occasionally there's some bruising. Very, very rarely there might be a light blister, but that's incredibly rare.
And do you think Vbeam will ever be able to use on other parts of the body for redness, or just the face right now?
We use it all the time to treat people who have red discoloration on their necks, and we also use it for small leg veins.
All right, Dr. Welsh, thank you so much for taking the time to speak with me. And if you would like to learn more about her, please check out her profile on realself.com. We'll see you next time.